Hello, meet Michelle, a woman researching about her health. And like you, Michelle just found out she has an ATM gene mutation. But not to worry. Together, you and Michelle will learn about what your journey ahead with an ATM mutation looks like. In this video, we will walk through A. What is the ATM gene mutation? B. What are some next steps and options? And C. What is the recovery period after surgery like? First, let's look at Michelle's questions about our first category. Michelle is asking, what is the normal function of the ATM gene? Let's take a look together. The ATM gene plays an important role in cell division and DNA repair. It helps regulate the rate at which cells grow and divide, and assists cells in recognizing damaged or broken DNA strands, and repairs the damaged DNA through activating repair enzymes. Because of the ATM gene's relation to cellular division and DNA repair, it normally functions to prevent tumors and cancer from developing. Looks like Michelle is also wondering how the ATM gene mutation affects the body. Well, toxic chemicals and radiation can cause DNA damage. When the ATM gene is not working normally, the body is more sensitive to these chemicals and radiation, causing an increased risk of developing tumors and cancer. A mutation in the ATM gene can increase your risk of developing breast cancer by 15 to 40%. The mutation can also cause your risk for developing pancreatic cancer to increase, but the increase is not as high as the risk for breast cancer and is about 5 to 10%. The mutation may also increase your risk of developing ovarian cancer. However, scientists have not completed research in this area, so the risk is not fully understood. Men can also inherit the ATM gene mutation, causing an increased risk of prostate cancer at about 11%. Although the ATM mutation means you have a somewhat higher risk of developing cancer than a typical individual, however, it may not fully explain why your blood relatives have or have had cancer. That leads us into Michelle's last question for this category. How is the ATM gene mutation inherited? Let's answer that for her. Everyone has 2 copies of the ATM gene, which are randomly inherited from each of your parents. If only 1 copy of the ATM gene is mutated, then your chances for you to develop cancer increase. There is a 50% random chance to pass on an ATM mutation to your children. However, if both copies are mutated, meaning that both of the parents have the gene mutation, the child can unfortunately suffer from a disease called ataxia-telangiectasia. This disease is an autosomal recessive disease, meaning that if both parents have 1 mutated copy of the ATM gene, they have a 50% chance of having a child with 1 mutated copy, a 25% chance of having a child with ataxia-telangiectasia, and a 25% chance they will have an unaffected child. Along with an increased risk of developing cancer, this disease also causes neurological problems that lead to difficulty walking and wheelchair use, slurred speech, difficulty writing and performing other tasks, red marks on the skin and eyes, and a weakened immune system. Now let's learn about our second category. Michelle wants to know what non-surgical options she has to manage her risk. Screening effectiveness and availability differ depending on the cancer type. For breast cancer, you have a few different options. You can have screening mammograms and 3D mammography. Screening mammograms are breast x-rays used to look for breast abnormalities or cancer in healthy women. In 3D mammography, the camera moves over the breasts and takes several layer-by-layer pictures. You can also have MRIs, which stands for magnetic resonance imaging, and is a technique for looking for abnormalities such as cancer using magnetic fields. It is often used to follow up mammograms. You can also have breast ultrasounds. Sound waves produce pictures of the internal structures of the breast. It is safe, non-invasive, and does not use any radiation. All of these are reliable options. Some women might be recommended by their doctors to have any of these tests more frequently than others, but they are usually done around once a year or every 6 months. For ovarian cancer, there has not been enough research to show a benefit from ovarian cancer screening and prevention in women who have an ATM mutation. For this reason, experts recommend managing ovarian cancer risk based on family history of cancer. For pancreatic cancer, screening is available to ATM patients if they have a first or second degree relative with pancreatic cancer. You can consider screening beginning at age 50 or 10 years younger than the age of diagnosis of your relative. This screening is not very reliable, and testing is still being developed. Finally, for prostate cancer for men with ATM, men should have a discussion with their doctors about prostate screening to evaluate the benefits and potential harms. For those who choose screening, annual PSA testing and rectal exams are recommended. PSA stands for prostate-specific antigen. PSA is a protein in the blood that can be measured to detect prostate cancer. PSA and rectal exams are typically more reliable than screening. Now Michelle also wants to consider any preventative surgeries she has available. Let's focus on breast and ovarian cancer. To reduce your risk of developing breast cancer, if you choose, you can have a bilateral prophylactic mastectomy. There are different forms of mastectomies, but this option is completely preventative, meaning performed before cancer begins. A bilateral prophylactic mastectomy is the complete removal of the breasts. Having this surgery done reduces your risk of developing breast cancer by around 90%. The risk cannot be completely eliminated because of how much breast tissue there is. It can be possible to miss the tiniest pieces. To reduce risk of developing ovarian cancer, if you choose, you can have a bilateral prophylactic salpingo-oophorectomy. Like the prophylactic mastectomy, the prophylactic oophorectomy is also completely preventative. This surgery is the removal of healthy tubes and ovaries. After surgery, you'll stop menstruating. You may have normal symptoms of menopause. You'll also be infertile after your surgery. The surgery can be performed using a large incision, a laparoscope, or a robotic arm. Ask your doctor which type is best for you and why. Because the increased risk of ovarian cancer for women with ATM is not yet completely understood, discuss with your doctor whether or not this surgery is the right option for you. After learning about these options, Michelle is ready to move on to our third category. She wants to know, if she chooses to have preventative surgery, what will her recovery be like? For the bilateral prophylactic mastectomy, some things to expect are temporary soreness in your chest, underarms, and shoulders, possible numbness across your chest that may be permanent. Surgical drains will be inserted inside your breast area during surgery that typically stay in for about 1 week to 10 days. Limited movement in your arms or shoulders, scarring, and physical therapy for arm mobility and upper body strength. After having a mastectomy, some women consider breast reconstruction to restore their appearance before surgery. Although each case is different, most mastectomy patients can have reconstruction. Reconstruction can be done at the same time as the mastectomy or a few months afterward. If you choose to wait, your doctor may recommend tissue expanders and saline solution, which stretch the skin in preparation for permanent implants. After a mastectomy without breast reconstruction, it can take 3 to 4 weeks to feel mostly normal. If you have breast reconstruction, recovery can take 6 to 8 weeks. Recovery can vary for each individual, and in some cases, it can take a few months to return to regular activity. For the bilateral prophylactic salpingo oophorectomy, some things to expect are laparoscopic or robotic surgery may involve an overnight hospital stay. Open abdominal surgery may require a few days in the hospital. After surgery, you may have bandages over your incisions. Don't put lotions or ointments on the wounds. Your doctor may prescribe antibiotics to prevent infection. You may also need pain medication, especially if you have an open surgery. You'll be instructed to avoid lifting more than a few pounds or engaging in strenuous exercise for a few weeks. Expect some vaginal discharge following surgery, but avoid tampons and douching. Possible symptoms of menopause such as hot flashes, night sweats, vaginal dryness, difficulty sleeping, and anxiety and depression might also occur. It may be wise to meet with a fertility expert before scheduling the surgery and consider your options if you would like to have a child. Following through with this surgery means you can no longer get pregnant. The sudden loss of estrogen can also affect the body. Talk to your doctor about preparing for this change and consider discussing the pros and cons of hormone replacement therapy. Now, Michelle better understands her options and is prepared for her journey ahead. Look at Michelle's smile. My name is Lilianna Messina, and I am a high school class of 2022 senior at St. Luke's School in New Canaan, Connecticut. Thank you all for watching and supporting my project. Best wishes for your journey ahead.
Created using Powtoon.